everyone, and welcome back to the Dewaxify series. This patient comes...
Your ear will be really sensitive to air, so when you go outside you'll feel the cold air coming. So it builds up in front of it.
Hi everyone, and welcome back to the Dewaxify series. This patient comes and visits quite regularly because when his ears get blocked, his tinnitus gets a lot louder and it starts to bother him. And so he comes in approximately every 4 months or so, and you can see his ears are quite blocked, even though it's only been about 4 months since his last treatment. The wax tends to be it's wet from the drops and it's soft from the drops, but it's very sticky. It really sticks to the sides and the walls. So I'm just trying to get a grip on the wax as a whole and try and remove it, but it's not doing that. There we go. So you can see there's a wall of wax, and holding onto it and trying to bring it out. It's breaking up into pieces, but there we have enough suction there to pull it out as a solid piece. So that goes onto the tissue, and this is what's left behind. Some wax around the sides. Just bring it into focus. That wax is quite a bit deeper. He does wear in the ear headphones sometimes. And I'm just bringing that piece forward all the way from the back of the ear canal right to the front, a big solid piece. Just a bit of a tidy up around the sides there. It's just coming away, quite dry wax on the wall. Really gently just scooping that away with the suction tip from the sides. Some on the sides again. What I'm trying to do is pull it out as a solid piece again from the wall. But there is quite a lot of hair which holds on to the wax and stops it from coming away as easily. comes out in little pieces and little chunks. There we have the whole eardrum, nice and healthy. Thanks for watching.